Welcome to day 8 of the Healthcare Provider Workers' Compensation Bootcamp. My name is Andrea, and today's topic is return to work for healthcare providers and the work status report. So if you've been a trooper and working out with us in the other bootcamp presentations, you might be a little tired by now. So recruits, some of you have stormed every station, climbed every wall, and crossed every bridge that we threw at you, and now you're in the recovery tent. So it is time to catch your breath in the recovery tent. Let's lock in on what you've learned and get ready for your most important mission of getting that injured employee safely back on the job. Our learning objectives for today are to know the benefits of recovering while on the job after an injury and reducing that medically unnecessary time away from the job, to know how to complete and understand the work status report, and then to know the rule that addresses return to work, as well as the form. So let's get started with our disclaimer, and that is this presentation is for your education, and we try to do our best to give you information about the workers' compensation system, but system participants, like healthcare providers, employers, insurance carriers, even injured employees, you're responsible for knowing and complying with the applicable sections of our laws and our rules. So if there's ever a dispute about what we've said here, or any kind of complaint or dispute, the rules are going to prevail and resolve those disputes. So for our overview, we are going to look at the goals and legislative intent. By legislative intent, we're talking about the laws that the Texas legislature have written for Texas and workers' compensation. And what did they intend for us to do with those laws? The DWC writes the rules that coincide with the laws or the act in the Texas Labor Code. So that's going to correspond to our goals. The rules are going to correspond to our goals as they relate to return to work. And we're going to go over medical literature and the support that it provides for how early return to work helps our injured employees. And treating doctors and other healthcare practitioner roles in returning injured employees to work. And these are the people that are providing that quality care to injured employees, can help them make that decision to return to work. And we want them to understand how important their role is in returning or keeping an injured employee on the job while they're recovering after an injury. And also, we'll go over the nuts and bolts of completing and billing for a work status report. And we'll also talk about an optional report that employers can fill out. And that's the description of injured employees' employment, the DWC Form-073. This is the sister form to the 73. So let's start with that legislative intent and goals. The overarching goal of the workers' compensation system in Texas is to help somebody, an injured employee, return to work as soon as it is considered safe and medically appropriate by their healthcare provider or their practitioner. So that's going to be an individual healthcare provider providing that quality care to our injured employees. And we want to help remove all the barriers that may be perceived or real by that injured employee so that they can make that choice, again, make that choice to return to work. And everybody should be facilitating and helping that injured employee return to their lives in a productive role in their workplace. And the intent is that the workers' compensation system must encourage that safe and timely return to productive roles in the workplace, provide high quality medical care that supports the restoration of their physical and psychological condition so that they can, after that injury, get back to their pre-injury earning capacity or earning capacity that matches their skill set and their capabilities. So injured employees may have permanent impairment after an injury, but that doesn't mean that they cannot work in some capacity. And there is regulatory structure around return to work in the Texas workers' compensation system. And that includes our goal of being that the injured employees receive high quality medical care. In the Texas Workers' Compensation System, we have treatment guidelines both for network claims and also the other side, non-network claims. The treatment guidelines, they're in place, they're evidence-based medical guidelines for that high quality treatment that's going to be presumed to be medically necessary in our system. So these guidelines, of course, they're not black and white. Again, they're guidelines for our healthcare providers to follow as far as recommended treatment for the injured employee after the injury. And also, we have return to work guidelines for the Texas system. And these are commercially available products through online subscriptions, both the treatment guidelines as well as the return to work guidelines. And these are not required for treating doctors to have, but the rules say that they shall be followed. So it's a good idea for you to purchase these, but the return to work guidelines especially are very helpful as they're going to give that disability duration specifically in the amount of days expected for someone to be off work or have that modified duty. So I'm going to show you our return to work guidelines here in just a little bit. I'll give you more information about that and we'll go to that website. Um, and also just something to keep in mind, we provide education to employers across the state of Texas. We encourage them to develop a return to work program for their employees so that they can connect them back into the workplace as soon as it's medically safe and appropriate. Employers hold the key to modified duty or to offer different job to that injured employee after the injury so that the employer, they have a very important part in clearing the way for that injured employee to come back to their lives, go back to the productive role. And in addition to the education that we provide employers, we also have a return to work webpage that has a guide for employers to so that they can actually develop their own return to work policy. And then, of course, case management uh, can come into the picture when maybe there's an injured employee that has surpassed the number of days when someone typically recovers from their injuries. In the guides, specific injuries, specific to job titles can be analyzed. So the insurance carrier, if they see that somebody's creeping past that number of days for recovery, maybe someone has delayed or failed recovery, they might assign a case manager to help facilitate that injured employee's care um, that they're receiving and actually encourage them to return to work. So, healthcare providers out there, please know case management is a part of our system. So, you may hear from them. And of course, please work with them to help these injured employees get back to a productive life and maybe even return to another type of job. It just depends on their situation. So there are some charges that you can bill if you're treating a referral doctor participating in case management. And the guidelines for that would be in chapters 137 and rule chapter 134. So there's a lot of medical literature out there detailing how return to work or stay at work after an injury helps someone recover and helps them recover better and faster if they stay connected to their job. So keep in mind, if someone stays off for more than 6 months, uh, there's less than a 50% chance that they're going to go back to work at all. So regardless of whether it's for their current employer or a different employer. So we see consistently that returning to work as soon as it's medically appropriate is imperative to helping this person avoid financial difficulty, especially. So some doctors in our system, talking about the medical associations, may be occupational doctors and members of ACOM, and their position statement says, and I quote, that a large number of people who, due to a medical condition that should normally result in only a few days of work absence, end up withdrawing from work either permanently or for a prolonged period. So most injuries in the state of Texas they're going to be temporary, but as a lot of us have seen, even a strain or a sprain can spiral out of control if it's not handled appropriately by all system participants. So this is going to include the treating doctor, the employer, of course, as well as the carrier. And ACOM definitely supports that. Also, the International Association of Industrial Accident Boards and Commissions has many position statements on early return to work and how it's beneficial for our injured employees to recover. The AMA as well has literature on return to work, American Academy of Orthopedic Surgeons, AAOS, and many more. The articles that we talked about uh, that show that there's a lot of benefits of working through recovery. So injured employees, they're going to recover faster if they're staying connected to their job. They're getting up, they're getting dressed, they're going to work in some capacity or even part-time. Um, they are going to recover faster than they would staying at home full-time. Of course, I'm talking about people that are medically cleared to go back in some capacity. The work that they're doing has to be safe and appropriate. The risks of injuring themselves and others has to be minimal, if not at all. And their healthcare provider is going to be making those decisions, right? Are they ready to go back? Are they ready to be cleared? So also benefits of working after a work-related injury. Um, One of the benefits is to prevent deconditioning. So, like I said, if they're getting up, they're getting dressed, they're going somewhere, being a part of group helps, as well as the physical and mental conditioning of that injured employee. So, people can decondition pretty fast if they're staying at home, especially if there's no medical reason for them to be at home. Some expressions that I've heard recently, um, and you might want to keep this in mind, is that motion is lotion, right? Sitting is the new smoking. I've also heard that scrolling is the new smoking. So imagine an injured employee sitting and scrolling all day instead of returning to work, even part-time, right? We want to prevent that deconditioning of our trained and experienced employees. Also, there's psychological impact as well as social impact to someone staying at home that doesn't have a medical reason, a true medical reason for staying home. Like being isolated from their work group can cause more dysfunction in their lives, so we want to minimize that dysfunction. Sometimes injured employees have some sort of pre-existing, maybe anxiety, depression, that could get worse if they're not staying connected to their work people, to their work team that might help provide that social social connection for them. Also, their job skills, right? Seems like things are changing at my work and in society in general in the blink of an eye. So I can think, even like a manufacturing job, things might be changing a lot and very fast. So how are they going to retain their job skills if they're home for something that's not some reason that's not medically necessary? We want them to retain and continuously improve their job skills. Because even if an injured employee is coming back to work part-time, or even, on a limited basis, they're still going to be staying connected, knowing about any changes that are coming up. So the injured employee may be able to keep their job, period, right? In Texas, an employer may not retaliate against an injured employee. They may not fire them simply because they got injured on the job. However, if someone is not able to fulfill their job duties and that employer is following their human resource policies on absenteeism, they may need to fill that job so they can get their business done. So it doesn't mean that they can't lose their job. It just means that they can't be fired in retaliation for having an injury. So it's clear the sooner that someone gets back to work in some sort of capacity, the more likely it is that they are to keep their job. The consequences of medically unnecessary lost time can be significant for an injured employee. It can include being in poor mental and physical health with their social isolation at home, In workers' compensation, there are wage replacement benefits for an injured employee, but it's not 100% of their wage. Definitely not a pot of gold at the end of that rainbow. Their benefits come in the form of a percentage of their average weekly wage. So temporary income benefits, or what we call TIBs, is 70% of an injured employee's average weekly wage. That can cause financial hardship. That could add to the burdens that someone's trying to recover um, from a physical or even a psychological injury. So adding that layer of stress on somebody, of course, medical literature shows that they're going to recover slower. So the answer is to have a return to work program, stay at work opportunity for that person. It can help reduce that financial hardship. And we see where there's difficulty in someone recovering, might even start causing fights at home, divorces. Somebody might have to drop out of school. Maybe they can't pay their rent or their mortgage. These are significant barriers to recovery and returning to the workplace. And we talked a little bit about social isolation. I think all of us can relate to how that can hurt us, especially during the pandemic. It was very difficult for people when they had social isolation for days on end. So keep that in mind, right? We all can have empathy for that and how it plays a role in an increase in anxiety and depression as humans, staying connected, being part of that group or community, it's important. So we don't want them to lose that connection to their workplace. Injured employees, they could also lose their job-related benefits if they're not receiving their wages. Think about them, they'll stop paying into Social Security. Maybe they'll start using up all of their sick time. Maybe they're not paying into their 401k for that matter. So there's lots of things going on that they could lose in addition to part of their salary. So um, the longer that they're at home, like we talked about before, they could ultimately lose their job. So keep the title of this slide in mind. It's medically unnecessary lost time. So I just want to be clear. Some injured employees, they may require rest and recovery away from work, but it's the healthcare practitioner working in conjunction with that injured employee to make the decisions of what they can and can't do safely back in the workplace. So that brings us to our treating doctor and other healthcare practitioner roles in return to work. Returning an injured employee to work after an injury, this is a shared responsibility, and that's going to include removing barriers and encouraging somebody to come back to work. So this responsibility includes us here at the Division of Workers' Compensation. I'm going to show you our return to work page on our website so that you can see a graphic as well as some other resources. So if you go to the Texas Department of Insurance, tdi.texas.gov main website. Up here at the top, you see workers' compensation, and you can scroll down here. Workers' compensation A through Z are for return to work. Right there. And this whole page has a ton of resources. We have videos, benefits, and we have our tools for injured employees and employers, healthcare providers. So if you go there, it has all sorts of tools for you. Okay. So be sure that you check out those resources. They are very helpful. So treating doctor, just keep in mind, the first thing is to set return to work or stay at work expectations or goals with the injured employee from the very beginning, right? During the first visit, if it's appropriate. Let's talk about your returning to work. So this should be something where you are setting those expectations with the injured employee about the recovery, about returning to work. And they may bristle, think that you're trying to send them back to work that day or the next day, that it is too soon. But talk to them in a way that helps them understand that returning to work is something being done for them, not to them, right? We saw all that literature. They maybe haven't thought through all of the benefits of returning to work. And for sure, they probably haven't thought about the consequences of medically unnecessary lost time. So this is where your MD guidelines can come into play, where you can look at the expected duration of disability. You can set those expectations for how long you think they might be in pain, when they can return to work in some sort of capacity. And again, doesn't mean that you're rushing them back to work. It just means that it's important to measure that health outcome. Return to work should be one of those health outcomes you're measuring for your medical interventions, and ask, are my interventions working, right? Are they recovering as I expect they will? An injured employee's return to work should be one of those outcomes that you measure. Again, um, return to work should be a normal part of this exam for that injured employee. So discuss those expectations from the first visit, talk about them often. You're also going to be communicating regularly with referral and ancillary providers. So if I'm the treating doctor and I've sent my injured employee to an orthopedist or physical therapist, we should be communicating all the time. You both should be on the same page as far as returning to work expectations and what that person can and can't do safely. So, treating doctor, you are ultimately responsible for the coordination of care for that injured employee. So make sure you're staying in touch like you should be just for their health care, but also about return to work specifically. Also incorporate return to work in your treatment plan. So just as you take out that prescription pad for physical therapy or prescriptions, it should be treating that return to work as an incorporated part of that treatment plan. And use the division's return to work guidelines, which is called the MD guidelines, for non-network claims to look at those disability durations, um, the information and the values that go along with their injury and their job. So if you're working with a network claim, you should look at your contract to see what your network is going to require you to use as far as a return to work guideline. Um, but you have to use one. So for networks, they get to choose their own. For non-networks, it's the MD guideline. So the MD guideline, it's a commercially available product, costs money to have a subscription, and the rules say that you shall use the return to work guidelines for evaluation of expected and average return to work timeframes. And you can find the MD guidelines at this webpage or call that number to find out more information about purchasing it. And again, it's not a requirement to purchase it unless you're a designated doctor, right? You have that special training, special designation. But again, it's kind of like operating in the dark when you don't have what we consider to be that scientifically valid, evidence-based medicine. So I'm going to go ahead and pull up the MD guidelines right now and show you what it looks like. So I am already logged in, and this is what it looks like, the MD guidelines. And I'm already here on my dashboard. Um, so the ODG, which is our treatment guidelines, and the MD guidelines both have return to work and treatment guidelines. And then non-network side of workers' compensation, the ODG is used for treatment guidelines. MD guidelines are used for return to work guidelines. So this is what I have up, the MD guidelines, and we're going to be using uh, the durations view only. So we're going to take a look at this. There's the durations that pops up, and it's going to be asking me for an ICD code or procedure code or a keyword. So I'm going to put in low back pain. So I should have a list pop up. So I'm going to go to other low back pain. And as you see over here, it already populates to a heavy activity level. So this is pretty cool because you can go up to very heavy. As you see that increase the expected days, right? We're going to be looking at the early expected um, days for going back to work. And you can customize this. Also, I'm going to move this back down to medium. Oops. The neat thing here, it has a job title explorer. So I can put in exactly the kind of job that my patient might do if I was a doctor. So I'm going to put in truck driver. And I see heavy and tractor trailer truck drivers. And I'm going to apply this to my model. So it shows here they have a medium work level. And from the date of injury, early return expected, and then evaluate at this number of days. So that populates there for you. Something else that's really neat down here, you can add in comorbid conditions if you need to, and they may or may not change the expected outcome for this person. So I'm going to put in, maybe they have obesity, and maybe some little bit of depression. So I'm going to calculate this out. And still my early expected and evaluate days remain the same. But that is a really nice tool to have to add those changes there. Hopefully that gives you sort of just a nice look in there at that um, as your tool to use. So you also need to be aware, treating doctors, any non-medical factors that might interfere with a successful treatment and return to work plan. So I know that treating doctors can't control all of the things that are going on in this person's life, obviously, but just being aware you're treating a whole person, not just someone with a job title, right? This is a whole person. So those non-medical factors, they may be what's interfering with successful treatment and return to work. So if you can help in that area, please do that, right? Maybe there's social issues like they can't get a ride, or maybe there's other things going on at home you might have an idea about. So just be aware of those things that might interfere and cause that delayed or failed recovery. Also, you can encourage the injured employee to take an active role in their recovery. If they're on the passive side, if they don't realize that they can communicate with you, right, uh, and tell you what they think and tell you what they think they can and can't do back at the workplace, they need to know that they can do that, right? They can talk to you about that. They can take on that active role in their recovery. That empowerment can help them understand that if they make the decision to go back to work, you're going to do everything in your power to help them get there. Um, that pain, everybody has pain at one time in their life. Lots of us experience pain every day. So pain doesn't necessarily mean that you can't be active or you can't work. I know back in the day, if somebody got injured, they would say, go rest, go lay down. And that might end up being for a long period of time. So I remember that in my early workers' compensation days, right? Seeing periods of time that people were just told to rest or, lay down in bed. That just ended up making things worse. So movement in a measured, progressive way, that's going to be really good for our injured employees to help them stay active and get back to their lives to the extent that they can. That's normal. So you're going to specify what they can and cannot do on the DWC Form 73. That's the work status report. And there's also maybe some misconceptions around maximum medical improvement or MMI. This is a date that the treating doctor assigns to an injured employee, saying this is as good as the injured employee is going to get. There's no further material recovery for that injury. So there may be misconceptions that you can't release them back to some sort of duty before they reach MMI, and that is a mistake. Remember, they can recover, they can get better while they're still on the job. So don't let that MMI date impact how you fill out that 73 form. So you can release somebody back to work before MMI, and even if they reach MMI, they may be able to go back to work with some restrictions, or they may not be able to go back to work even when they reach MMI. So misconceptions on either side of that date might come up. But remember, your job as the doctor is to decide what they can and cannot do physically. You need to work with the physical therapist, talk to them about the injured employee's physical abilities, or the referral doctor, talk to them about that, get on the same page because you don't want competing DWC Form 73s. Then the injured employee is going to be confused. It might spark some unnecessary disputes. We had a webinar recently that someone actually had that question, right? I have a DWC 73 from a treating doctor that says one thing. I have a 73 from someone that they were referred to by this person that says something different. These people were not talking to each other, right? And it just confuses everyone. So make sure that you're talking with them and release the injured employee to work as soon as is medically appropriate. And the employer, they can take things from there. They can make those employment decisions. Something super important to understand also is if the employer doesn't have exactly the same job or they only have part-time, this is not going to impact their eligibility for income benefits. The temporary income benefits are going to be adjusted depending on how much they're earning. So if they're going back to work part-time, only earning half of their average weekly wage, the temporary income benefits, the TIBs, they're going to be flexed up or maybe they'll come down a little bit, depending. But the injured employee is going to be entitled to those temporary income benefits to compensate for any lost wages until they reach maximum medical improvement. After they reach MMI, then there may be some other benefits that they're entitled to. And I've talked about this several times about collaboration between the treating doctor and the injured employee on establishing return to work goals. Some of the responsibility is also on those ancillary providers and the referral doctors, the orthopedists, the neurologists, the surgeons working with the treating doctor to help establish these goals. The physical therapist, they have some responsibility to collaborate with the treating doctor on the return to work goals. I mean, think about that physical therapist. How much time are they spending with that injured employee, literally analyzing what they can and can't do? So please communicate and help that physical therapist or occupational therapist know that if they focus on the positive, explain to that injured employee that they're going to get better faster if they go back to work in some sort of capacity as soon as it's medically safe and appropriate. Again, something being done for them, not to them. So if you're going to coordinate the injured employee's healthcare plan and work status with that treating doctor, the referral doctor does have a responsibility as well to also submit that 73, as long as it's one of the situations that's required by rule. So let's go over completing and billing for this very important form, the DWC 73, which is also known as the Work Status Report. So what is the DWC Form 73? It is a communication tool. And yes, you're going to be documenting what they can do and what they can't do safely. But it also is something that you can put in front of the patient and guide a discussion about what they can and can't do. That form also goes to the carrier, it goes to the employer, and it needs to be understood by all of the parties that are receiving it. Does the injured employee understand what you're writing on it? Hopefully, you'll have received the form DWC 74 that the employer filled out. That's the sister form to what you're looking at on the screen, the 73. hopefully the injured employee would have seen that and noted how similar they are. Please don't just throw that work status report, that 73 form at the injured employee and walk away. This is a discussion and a communication tool for all system participants to understand what that injured employee can do, what their functional ability is, and whether they have to go back to work with the restrictions, or maybe they can return without restrictions, or if they can't go back at all. So that's what the Form 73 is all about. And when is it required to be submitted? 73 should be submitted when it's required, um, which is first off on the very first visit. Again, establishing early return to work goals is important on that very first visit, unless, of course, it's the emergency room. If you're a doctor, treating doctor, referral doctor, you're seeing this patient for the first time for that injury, you also need to fill one out. You need to fill out the 73, and that includes a delegated physician assistant or advanced practice registered nurse is seeing this person for the first time. So they also need to fill out that work status report. And they are allowed to fill this out and complete it if they're the ones seeing the patient on that first visit. So after that, anytime activity restrictions change substantially, or maybe they can go back to work on a part-time basis from being unable to, so they go from being unable to work, now they can work part-time. If anything changes in their abilities, their functional abilities, or their work status, you need to complete another 73. Sometimes the insurance carrier wants a 73, and they can request that, and you can fill it out, but it must be based on scheduled appointments. So associated with an exam, but um, not more frequently than once every 2 weeks. So if the insurance carrier is requesting it, use these conditions for when you are completing one, because we do want you to get paid. Notice on the slide, it does not say every visit. And there are some people out there that file these 73s every time they see this person on every visit. But again, they may not get paid unless things keep changing, but that's a pretty rare situation that things will be changing that often. So on the first visit, when anything changes and upon the request of the carrier, that's when the rule requires it, and that's when you can bill for it. So let's go over specifically, what does a change of work status mean? A change of work status means one of three things. One, the injured employee is allowed to return to work without restrictions. It's not the same thing as MMI. Keep that in mind. Two, is the injured employee, they may go back with some restrictions. Maybe they can work in a limited capacity or a limited number of hours, maybe only standing and no climbing, or maybe no reaching. It just depends on their situation, their injury. Number three, that compensable injury, we think about it as a payable injury, prevents the injured employee from returning to work at all. Another definition is substantial change in activity restrictions means that from the last 73, maybe they were only able to lift 10 pounds and now they can lift 20 pounds. So it prevents them from working, or maybe they got worse from the last 73. For example, maybe their arm wound opened back up and they can't reach now. So anything that changes with the activities that they're able to do, either they have more restrictions or less restrictions, maybe they have an expanded ability to function, then you're going to want to complete another 73. So that's a substantial change in activity restrictions that justifies and requires another 73. So who gets this form? So we talked about that earlier. Definitely the injured employee gets it, right? They get it, and they also have it explained to them what it means. If you happen to be doing telemedicine, you're going to electronically deliver it to that injured employee. So again, it's not just hand it over, let them figure it out, hope that the employer gets it. No, it's make sure that they understand what you're writing. Again, have that discussion with the injured employee empowering them to say and participate in that discussion and the determination of their abilities. The employer gets the form also not later than the end of the second working day after the exam. So you can send it to them electronically. The most important thing is they need to understand what it's saying because they hold the keys to making those work opportunities available for that person based on what you're telling them. Also, the insurance carrier is going to get it. So not also not later than the second working day, not calendar day, the second working day after the date of the examination. You can send that by electronic transmission as well. The carrier should be monitoring all of the changes in their work status so that way they can take those income benefits and accurately, timely pay those out to the injured employee. And now we're going to look at the form and what it looks like in sections. So this is the top of your work status report. This is the DWC 73. Most of our forms on our website they're going to fall under F for forms. You're going to have instructions on the second page. So if you printed it out, just that first page, you want to see the instructions, you can always go to F for forms and see that whole form plus the instructions. Now in part 1 up here, this is where you're going to put demographic information about your injured employee who's filling this out. Also down there in box 4, this is the injured employee's description of what happened. See where it says employee's description of injury/accident. So what was the incident that happened that created that injury? You're putting the injured employee's words in there, not yours. Okay. In section 2, the work status information, that's where you're going to make the selections into those 3 different work statuses. So section A, B, or C, right? A is they can go back to work without restrictions. And then you provide that date. Or B, they can return with restrictions between this date range. Or option C, they cannot return to work as of this day through this day. So don't ignore that very bottom section. That's where you're going to be putting a description of how the injury prevents this person from doing anything back at the workplace. This is a very important field, so it should be filled out by the clinician. So this form in particular is an example of someone who can return to work without any restrictions because that provider selected 13A. This is an example of the form that's filled out where they work with restrictions. And then, as we said before, we get that date range in there from this date to this date. And then this is an example of someone who is unable to work at all. So they're going to check box 13C, and then the explanation is going to be put in that section, and it needs to tell us exactly why medically that injured employee cannot return to work. So things like the employer doesn't have a job for them, or just pain, like it says there, that's not okay, right? It's not sufficient. Medically unnecessary lost time can be as high as 60 to 80% of workers' compensation claims. So imagine all of that time that's due to a non-medical reason, right? So we really need to understand medically why they are away from work. So we want to identify those barriers and remove them if they exist for this person returning to work. So if you're checking 13C, again, a medical reason or a psychological reason, we have injured employees, of course, that have psychological injuries and trauma. So tell us how come they can't return to the workplace in any capacity. If you're just putting pain in there, again, not sufficient. And it may be the thing that's preventing them, but you need to tell us more why they cannot do anything back at the workplace. So this is important, and we do monitor this in our system. If you're checking 13C, just pay attention and help yourself avoid trouble. The DWC, we're tasked with doing performance-based oversight audits of medical providers, and 73s are randomly selected. And currently, only about 60% of forms that are audited do not have an acceptable description in that box. So this is a really big deal and something the division pays attention to. This is an example of a very clear, acceptable explanation, right? Persistent abrasion, healing ulceration, right low leg, on antibiotics, infection confinement to minimize risk to the injured worker and their coworkers. That is very clear. So further down on the form in section 3, they're going to tell us what the activity restrictions are. So the maximum number of hours that they can be in a certain posture, or how many hours, motion restrictions, anything miscellaneous, lifting, carrying, what it's restricted to, and if it's to a certain body part. Also in section 16, if there's any other communication about what you think this person shouldn't be doing, you can put that there. That's a free text box. And then in box 20 is medications. So um, these are the specific activity restrictions that the clinician should be filling out and discussing with the employer. They're going to take the baton from you, right? You're going to pass the baton to them. They're going to take over, make those employment opportunities, decide what they can offer this person. And again, notice the injured employee should know what they can and can't do, and it should be clear. Um, and also the employer has, and they should know that the employer has this information too, and that's going to help resolve confusion, right? And again, remove those barriers around them making that decision to go back to work. They know what to expect and they know why. The last section that you're going to be talking about is follow-up. Do they need to come back for some more appointments? This is going to help that employer know information and coordinate with the injured employee when they have to go back for more appointments. So if they have a referral or a consult on the books, maybe they're still getting physical therapy, you need to put that expected follow-up services, what they're going to include, and special attention to that last box, right? Check that one if there are none. And this is where you can communicate to the employer and the insurance carrier that this is the last scheduled visit for this problem. At this time, there might be no further medical care anticipated. So that's really important to let them know. You might start getting calls asking for the 69. Are they at MMI? Let us know. That's the report of medical evaluation. And this may be because the carrier is looking for information about, is this the last scheduled visit? So if you use this section, you could send this 73 and then let that carrier know this is the last office visit. So communicate in these fields, let them know what to expect as far as follow-up services for that injured employee. And then, of course, the signatures are important to have there so that everybody knows who is filling out this form and what role that they are playing. In this case, this is an advanced practice registered nurse that's going to complete and fill out this form. Again, if they're properly designated by the treating doctor, they can fill out this form, no problem. So billing for the work status report. Rule 129.5 is the work status report rule, and it's going to address all the things that I've gone over so far. It's going to tell you when you can bill and how you can bill for that work status report. And remember, it's on the first visit. Anything changes, and then also when the insurance carrier requests it, you can bill for the work status report using CPT code 99080. And that's going to be with modifier 73 for $15. And the insurance carrier, they should reimburse, um, of course, only when you're following the rules. So keep in mind, if you're billing a 73 on every visit, that may or may not be required by the rule. So follow the rule to be justified and get reimbursed for your work. One other form that I want to tell you about happens to be my personal favorite form in insurance the whole workers' compensation insurance universe. This helps communication between the employer and the healthcare provider. So if you are a treating doctor talking to an employer, trying to determine what this person can or can't do safely back at their job site, and you've got an injured employee in front of you that may or may not remember things because, they got injured, they may be not thinking as clearly. An employer can fill out this DWC Form 74, help explain the tasks and the duties associated with this injured employee's job. Again, it's not required for the employer to fill it out, but we do educate the employers across the state of Texas. Went to Abilene not too long ago, so all over the state that this form is out there for them to have it ready to send with the injured employee when they go to get treatment, or, they can of course send it later. But as long as that healthcare practitioner can see this form that comes from the employer, it's going to help them make better decisions about what the injured employee can and can't do as far as their job functions, their duties, what specific tasks they can do, physical responsibilities at the workplace. This is, again, it's the sister form to the DWC Form 73. And if you notice here, it looks very similar to the 73. We wanted it to be apples, comparing apples to apples to make it as easy as possible for that healthcare practitioner that's filling out the 73. So you can take information directly from here. Um, that injured employee can be providing this to the doctor, or the employer, of course, could send it over, or healthcare practitioner, if you're in a if you're stuck, you can call the employer and say, hey, there's a Form 74. Do you mind filling it out? That's really going to help me. Do they have to? No. But do we encourage them to? Absolutely, we do, right? We remember on our return to work page, we have that whole program set up to help them understand how to fill this out. So the Form 74 is out there for your use. So if you're a healthcare provider and you know that your injured employee have some changes in their functional ability, maybe they have permanent impairment, or maybe you know that they did lose their job. There's the Texas Workforce Commission, our sister agency that offers free vocational rehab services to our injured employees of Texas to help them prepare for, obtain, and get another job that does match their abilities. So you can refer your injured employees over to the vocational rehab section of the Texas Workforce Commission. They will be happy to work with your injured employee about getting back to some sort of job that's going to help their health in general. At the Division of Workers' Compensation, there are certain types of injuries an injured employee that maybe has been off for 12 weeks or more that we would look at specifically, and send that list of those injured employees over to the Texas Workforce Commission to reach out, help those injured employees. So these injured employees can also self-refer, even if they don't, if they haven't been off work for 12 weeks or they don't have those specific diagnoses or conditions, anybody can use the Texas Workforce Commission vocational rehab services for eligible adults with disabilities that can help them get back into the workplace. So a shout out to them. It's a good tool to know about and to help your injured employees. And studies show that if an injured employee, again, if they've been off work for 12 weeks, their possibility of ever returning to the workforce drops dramatically. So that's why we're here to try and educate healthcare providers, employers, injured employees that the sooner they get back to work, the better and faster they're going to heal. And of course, we want to keep it within the restrictions that the doctor has identified. So to review what we've talked about today, we talked about the goals and legislative intent of the Texas Workers' Compensation System, the legislative intent for returning someone to work, medical literature that is out there supporting return to work and staying at work after an injury. We talked about the roles for our healthcare practitioners, our treating doctors, mid-level practitioners, as well as referral doctors um, that they play in getting someone back to work, and then also completing that DWC Form-73, the work status report, and the description of the injured employee's employment, that's 74, filled out by the employer. That's not required, but definitely could be a lot of help to our healthcare providers. So, thank you so much for sticking with me. Now we're going to flex the knowledge that you have hopefully gained during your time in the recovery tent from this rest that you've taken, reflection in the recovery tent. So we will hopefully have trained your brain, and we're going to go over some polling questions, and hopefully you can think of these answers and answer them correctly. So question 1, return to work discussions should be early and often to minimize the bartering between injured employee and the treating doctor later, so there's less surprise and potential conflict. Is that true or false? That answer is true. This should be talked about on the very first visit and often using the DWC Form 73 as a communication tool. Question 2, the treating doctor should communicate regularly with the referral and ancillary healthcare providers about the injured employee's care and return to work expectations. That's true. Yes, definitely. Number 3, the treating doctor should talk to the employer about options for restricted or modified duty work assignments to assist the injured employee's recovery. And that's true. They should talk to them, especially if the employer is calling to ask questions about the 73. Question number 4, when is the DWC Form 73 submitted? On the first visit, when the activity restrictions substantially change, or the work status changes, or at the request of the insurance carrier, or all of the above? Yes, it is. It's all of the above. That's the correct answer. Question number 5. It's important for the healthcare practitioner to explain why the injured employee is prevented from returning to work. True. Yes. It is extremely important for them to explain why the injured employee is prevented from returning to work using that Block 13C text field to explain very clearly why this person can't do anything back at the workplace. So thank you so much for going over those questions. I hope you got them all right. After reflecting on this webinar and others in our bootcamp series that you attended, you might be wondering about some things that you learned, or maybe you have a situation that you need help with. You can always reach out to us at Comp Connection with your questions, and you can reach us at 1-800-252-7031, option 3, or you can email us 24 hours a day at compconnection@tdi.texas.gov. So thank you so much for watching this presentation.